So guys, now let's talk about the anatomical snuff box. Well, the reason I want to discuss the anatomical snuff box, this topic with you first, because if you have a fair idea about how anatomical snuff box is formed, what are the boundaries, what is there in the floor, that will also help you to understand and remember the structures in the extensor retinaculum. So it is my suggestion to you that when you read this topic, make sure you read the snuff box first, and that you will see in a couple of minutes that how snuff box will make extensor retinaculum this topic a bit easier to understand and remember. Well, when you talk about the snuff box here, the anatomical snuff box, which is present between the extensor pollicis tendons, let me discuss it on this picture first, and then we're going to draw it in a schematic way. Well, as you can see, this here is a snuff box. You can see the radial artery over there. That is the main content of the snuff box. Now, this anatomical snuff box is having this lateral boundary and the medial boundary. And as evident from the picture, you can see the laterally, it's more anteriorly also, it's laterally and as well as more anteriorly. You have the two tendons which are forming the boundary, whereas medially, or you can say more posteriorly, we have one tendon forming this boundary here. But ultimately, all these tendons are going toward the thumb only. So one first thing that you should keep in mind is that anatomical snuff box is formed by those tendons, those long tendons that we have, which are reaching the thumb region. Maybe it's metacarpal, maybe it's phalanges, but it has to be toward the thumb. The most lateral one here, you see this one here, guys. This here is the abductor pollicis longus. It's one of the muscle in the extensor compartment of forearm, deep muscle in the extensor compartment, and that abductor pollicis longus muscle, the tendon will be inserted here. You can see that on the base of the first metacarpal. Then you can see the two tendons, the longer tendons over there, which are reaching toward the phalanges here. This here is a tendon of extensor pollicis brevis. This here is extensor pollicis brevis. And quite evident here, look at this tendon which is going all the way and going toward the distal phalanx. So obviously this has to be the extensor pollicis longus. So actually anatomical snuff box is present between the pollicis brevis and the pollicis longus. But yes, extensor pollicis brevis is also assisted by another tendon on its lateral side, and that is abductor pollicis longus. I repeat again, abductor pollicis longus and extensor pollicis brevis more laterally. Extensor pollicis longus tendon is the one which is more medially. In between, we have the snuff box here. So I'm going to discuss this on a picture on diagram, and then we'll talk more about this using the same image again. So here we go. This, let us say, if this here is a thumb, and let us say this here is the index finger, we don't have to draw the entire thing. Just for the reference, I'm drawing that. That is a thumb over there. That's the index finger. So we said tendons like we have got an abductor pollicis longus. This is a tendon of abductor pollicis longus, which you will see reaching the metacarpal, the first metacarpal. Then we have extensor pollicis brevis. This is the extensor pollicis brevis. And then we have extensor pollicis longus tendon. So long tendon extensor pollicis longus. This muscle is taking origin from the posterior surface of the ulna. That is extensor pollicis longus. And let's presume this here is the anatomical snuff box. So let's label it on this picture first, then we'll talk further about it. So as we said, most laterally present here, this here is the tendon of abductor pollicis longus, and there is no question about it. It has to be abductor pollicis longus because the abductor pollicis brevis is one of the thenar muscle. Right now we are not talking about the thenar region, we are talking about at the back here in the snuff box region. Along with this abductor pollicis longus, this here is extensor pollicis brevis. Brevis means short, so obviously when you look at the distal attachment, brevis will not be going as far as the longus is reaching till the distal phalanx. And of course, this one here is the tendon of extensor pollicis longus. So to keep it simple, the snuff box is present between the extensor pollicis longus and brevis. Longus toward the medial side, brevis toward the lateral side. So that is where we have this snuff box. Well, this is about the boundary on the lateral side and the medial side. So this, if I say this here is the lateral, more anteriorly also, anterior laterally we can say, and this is more posterior or posterior medially. More important than the boundaries is to understand that what is there in the floor of this anatomical snuff box, guys. Obviously, there are certain bones which are present here in the floor. Floor will be by the bones over there. Now, all you have to do is just think about that what bones will be present in this region. And again, there's nothing to mug up. Like snuff box is obviously more toward the lateral side. So start thinking from this point onwards that the first thing you will see here is a radial styloid process. More distal to the radius will be the scaphoid bone, of course, the first the carpal bone in the proximal row. Then you will have the next scaphoid will be there, right? After that, what you will see? You will see the trapezium bone. You have to go in that sequence only. In the distal carpal row, the first bone will be trapezium. So we got a radial styloid. Next is scaphoid. Then next is the trapezium. And after trapezium, you will see the base of first metacarpal. They're all toward the lateral side here. So all the 4 bones here are present in the floor of the snuff box. In certain books, they've only mentioned 1 or 2 bones there. But if you do the radial deviation or ulnar deviation, all these bones can be felt in the floor of the snuff box. And apart from these bones, we have 2 tendons which are also there in the floor. I'll show it to you, but I'm going to write it first. So guys, the floor of the snuff box, first let's go with the bone. So we have a styloid, the radial styloid I should say. Radial styloid is there. Then next to the radial is the scaphoid bone in that sequence. That's a main bone present in the floor of the snuff box, the scaphoid. Next to the scaphoid it has to be trapezium. And then we have the base of first metacarpal. Base of first metacarpal. These are the 4 bones that you'll see aligned on the lateral side, and they're all forming the floor of the snuff box. Apart from these, we have 2 tendons also. Now this is obviously this bone, and bone here, the 4 bones. But when I talk about the floor, I need to write the 2 tendons also. One is the tendon of extensor carpi radialis longus and extensor carpi radialis brevis. I'm writing T for the tendon here. Extensor carpi radialis longus and extensor carpi radialis brevis. So as we said, 4 bones, and then these 2 tendons are also present in the floor. Now, how come these tendons are present in the floor of the snuff box? Guys, extensor carpi radialis longus and extensor carpi radialis brevis, these muscles will come from the back of the forearm, and these tendons need to insert on the base of the second and third metacarpal. So they have to go straight and insert onto the base of second and third metacarpal. So what you'll see, these tendons are passing deep to the tendons which are going towards the thumb. And that's why they are basically passing from the floor of the snuff box. Out of these 2, at least one we can very clearly see in this picture. If I just take you back here, look at that. In fact, we can see both, but one can be seen very clearly. I hope you are able to recognize the tendon in the can you see the tendon over there? That is ECRL, extensor carpi radialis longus. This will go to the base of second metacarpal. And if you carefully see, there is another tendon just beside that, another tendon over there. That is extensor carpi radialis brevis. This here is, let me enlarge this picture further for you so that you can clearly see it. Look at that, guys. I hope now you're able to see this one and this one here. That is ECRL and that is ECRB. So they are the one which are also, you can see all these bones over there. You can see the base of first metacarpal, trapezium, scaphoid will be there, radial styloid will be more proximal, and then these tendons are also passing in such a way that they are present in the floor, ECRL and ECRB. Now let me do one thing. Let me draw another diagram there and put all these 5 tendons, these 2 and this one, the one forming boundary, in a sequence, because this is really going to help you to understand and remember the structures or the contents in the extensor retinaculum. So before we go any further or write anything about in there, what I'm saying is, let us say we had the tendon going like this, 1, 2, and then we have, these are the boundary of the snuff box. Let's say this was the snuff box here. Let's keep it very, very simple. It's just for the understanding. And then we just said the 2 tendons which are in the floor, let me use a different color for that, are running in this manner. They are in the floor. Let me club them together. Let me give it number 1. the two tendons in the floor, ECRL, ECRB, let me give it number 2. And this lone tendon here, let me give it number 3. The difficult part in the extensor retinaculum is over. When you talk about extensor retinaculum, there are 6 compartments in the extensor retinaculum, which we will discuss immediately after this. 6 compartments. 3 compartments are there in front of you. So out of the 6 compartments in the extensor retinaculum, the content of the 3 compartments are there in front of you. The lateralmost or the first compartment of extensor retinaculum must be having these 2 tendons forming the lateral boundary of snuff box. The second compartment of extensor retinaculum is having the tendons in the floor of the snuff box. And the third content or the third compartment of the retinaculum, extensor retinaculum, is having the only tendon which is forming the medial boundary of the anatomical snuff box. So that's why I said if you remember the anatomical snuff box, in a way, half of your job in extensor retinaculum is also over here, right? Okay, let's just finish off this topic first and then we'll go to the next. So as we talked about the boundaries forming in here, and we also talked about the floor. Now what about the roof? What is there in the roof of the anatomical snuff box? Well, again, skin, superficial fascia, that is there everywhere. So we have the same thing there. Now we have 2 important structures which are also present in the roof. One is there in the diagram. I'll show it to you in the picture. One eye you have to imagine. Like, what is the vein running on the lateral side, guys? Cephalic vein. So the cephalic vein is the one which will be seen actually starting like this and was passing from the roof of the snuff box and then going up here. So one structure will be the cephalic vein. And the second structure in the roof will be the superficial branch of radial nerve. Remember MBBS, S, the fourth content of the cubital fossa. That superficial branch of radial nerve will come like this, deep to brachioradialis, will emerge more superficial here and will pass from the roof of the snuff box. That superficial branch of radial nerve can be seen in this. Can you see that? Look at that, guys. This nerve here is a superficial branch of radial nerve, and you can see the branches here are passing on the roof of the anatomical snuff box. Cephalic vein is not shown in there. That is okay. Cephalic vein must be present like this and then going in this manner above. So the 2 major structures apart from skin and fascia in the roof will be, one is the vein, that is the cephalic vein. The beginning of the cephalic vein will be there. And the number 2 will be the terminal part of the superficial branch of radial nerve. Superficial branch of radial nerve, that is there in the roof. Well, nothing to think about the content. Well, the content of the anatomical snuff box is what? That is a radial artery. Radial artery is the content. We discussed that in the arterial supply also, that when the radial artery reaches the wrist region, it turns backward, passes deep to these tendons as a content, and then will go through between the 2 heads of the dorsal interossei. So simply the content is the radial artery. I can show you that again in the same image only. Look at that. You can clearly see that radial artery, and I also want you guys to just think that the radial artery will be coming something in this way, will turn back, goes into the anatomical snuff box. If you see, it's going further. And what muscle is that? That is a first dorsal interossei. And that's what we said, between the 2 heads of first dorsal interossei, that's how it enters it. So it goes between the 2 heads of dorsal interossei and will go toward the palmar aspect to form what arch? Deep palmar arch. To form the deep palmar arch. So this here is about the anatomical snuff box. Now, using the same knowledge of the snuff box, let's apply it on the extensor retinaculum so that we can remember the structures in there. Now, one thing, guys, when you talk about the flexor and extensor retinaculum, the one difference is that extensor retinaculum location is on the dorsum of the forearm in the distal part. So it is not exactly present on the wrist. It is proximal to the wrist joint. And when you talk about flexor retinaculum is not here. Flexor retinaculum is stretched between the carpal bones. So you can say it is kind of distal to the wrist. Location wise, if we talk about extensor retinaculum, it is slightly proximal to the attachment is in such a way, it is slightly proximal to the wrist joint. But flexor retinaculum is more distal to the wrist joint because the attachment of the flexor retinaculum is on the carpal bones. Extensor retinaculum attachment is on the radius and ulna only. Simple. In this image, the same picture that we just saw, you can see an extensor, a part of extensor retinaculum can be seen. Can you see this big band over there? This thick band here is the extensor retinaculum. This thick band over is an extensor retinaculum there, right? And as I already said, what happens is this extensor retinaculum will give the septations inside. There are septation which will go inside and divide the dorsum of wrist into 6 compartments. So like first compartment will have these 2 tendons, next 2 compartment will have the floor of the tendon in the floor of the snuff box, next compartment will have the medial boundary of the snuff box, and so on. Then we have other tendons also. The best way to look into the extensor retinaculum is by taking a transverse section. So let's take a transverse section from the retinaculum region and see what structures are present in there. It's very, very easy to remember. We just have to follow certain logics here. Extensor retinaculum. So how we're going to see it? We're going to take a transverse section from the level of the wrist, and we're going to see it in this way. So we'll, just like you're taking a section from the distal end of the radius and ulna. So when you see the distal end of the radius and ulna, let us say, guys, this here is the radius bone. And let's say this is the ulna. I'm just writing R and U, that is radius and ulna in the transverse section. Below is the dorsal ventral aspect here, and this is the dorsal aspect. So you're basically looking at the wrist in this way, not in this way. In this way, you're looking at it. Extensor retinaculum, as we said, it is stretching from the radius and ulna only. So there we have it. This is the retinaculum. And we also said this extensor retinaculum will give the septations inside, dividing the extensor retinaculum, dividing the dorsum of the wrist into the 6 compartment. So we have the first compartment here, second compartment, third and the fourth compartment. The point to be noted here is that 4 compartments are in direct relation to the radius. Look at the 4 compartments are in direct relation to the radius bone. 1 compartment is in relation to the ulna, and the remaining compartment is between the radius and ulna. It will be easy for you to remember the content also. First 4 compartments that you see in relation to the radius, last one is on the ulna and one is in between them. 6 compartments in total. Obviously, all the counting here will go from the lateral to medial side. We count everything from the thumb toward the little finger. So this has to be the first compartment and this has to be the 6th compartment. Because they can ask you the question directly like, what is the content of 2nd compartment or 4th compartment? So make sure that you remember that counting has to be done from lateral to medial side only. Okay, one thing which we already discussed, and let me highlight that for you, that the first 3 compartment is something we already discussed in the anatomical snuff box. The first compartment was having the lateral boundary of the snuff box, guys. The tendon in the lateral boundary of the snuff box, there were 2 tendons there. Second compartment is having the 2 tendons forming the floor of the snuff box. And the third compartment is having the medial boundary of the snuff box. So what are these here? This is a compartment with abductor pollicis longus and extensor pollicis brevis. What compartment is that? That is a first compartment. You already know that. Second compartment, which is having the tendon in the floor of the snuff box. And what were those tendons? That is ECRL and ECRB, extensor carpi radialis longus and extensor carpi radialis brevis, are in the second compartment. Third compartment is having the tendon of extensor pollicis longus. Third compartment is having this extensor pollicis longus. These 3 compartments with the snuff box were done. Remaining 3 compartments are also very, very simple. Now I would like you to jump from 3rd compartment directly to the 6th one. Just have some logics and try to remember it this way. This compartment is present on the ulna. And what is the only muscle here in this compartment, extensor compartment, which is having the word ulna in it, like ulnaris? That is extensor carpi ulnaris. So the compartment on the ulna is having extensor carpi ulnaris. Simple. So this here will be having the tendon of extensor carpi ulnaris. Which compartment is it? This is the 6th compartment. 2 more to go. Again, very easy. Now look at this one, 5th one. Guys, 5th compartment, although it is not on the ulna as such, but if you compare this is still toward what side? It is toward the medial side only. 5th compartment is also toward the medial side. That means toward the ulnar side. Now, which extensor tendon you believe should be present on the ulnar side? Obviously, the tendon which is going to which finger? To the little finger. That is the one toward the medial side. So this compartment is having the tendon for the little finger. That means the tendon which is toward the medial side, and that is extensor digiti minimi. That's why the compartment in here is having the tendon of single tendon again, that is extensor digiti minimi, and that is there in the fifth compartment. Now the problem is solved because if you know all content of the first, second, third, fifth and the sixth compartment, well, whatever is left is there in the fourth compartment. So think about it. What is there left in it? We have one huge muscle over there, extensor digitorum tendon. The four tendons are there. So those extensor digitorum tendon will be there. Number one. We have an additional tendon for the index finger, that is extensor indicis. That also will be there. I think everything else is here. Extensor indicis will be there. And the nerve and blood vessel will also be there. Now I want you to again think of what we discussed in the beginning. I told you that the nerve here will be posterior interosseous nerve, no doubt. Posterior interosseous nerve is a continuation of the radial nerve, fine. But what artery will be there? The artery will be the anterior interosseous artery. Why? Remember, anterior interosseous artery was piercing the interosseous membrane and then running at the back here. So don't get confused that nerve here is posterior interosseous nerve, but artery will be the posterior nerve is posterior interosseous nerve, and artery will be the anterior interosseous artery in the fourth compartment here. Let me mark that for you. So we said we have this like huge tendon. We got an artery, we got a nerve. So first and foremost, what tendons are those? Let me mark that. The tendons here are, we have extensor digitorum tendon. I'm just writing ED, extensor digitorum, and extensor indicis. An extra tendon for the index finger. We have an additional tendon for the index finger extension. Extensor digitorum and extensor indicis. And yes, when it comes to nerve and blood vessel, it is the anterior interosseous artery along with posterior interosseous nerve, all present in the fourth compartment. That's a very, very important fourth compartment. Like I said, majority of the things are present in it. So we have two tendons here, extensor digitorum, extensor indicis. Nerve is posterior interosseous nerve, artery is anterior interosseous artery. So that is about the the structure's placement in the extensor retinaculum. Right? Not that difficult. It's just we have to follow certain logics. It's just there is certain sequence that you should go in, and there should not be a difficulty in remembering these. Now coming to the flexor retinaculum. Now let me take you from this region to this region here. That is toward the palmar aspect we are talking about in here. Now let's come into this region here. But as I said, when you talk about flexor retinaculum, you got to go more distal. So the flexor retinaculum attachment is basically between the carpal bones. I'm going to show you the picture for the flexor retinaculum, and then we go into the detail of it. Okay. Look at this image first, guys. Look at this picture here. This is the one which in which you can appreciate the region for the flexor retinaculum. Well, flexor retinaculum is present in here. That's a site for the flexor retinaculum here. Now, what do you see? If you look at the flexor retinaculum here, there are certain structures passing superficial to it. You can see a tendon passing superficial to it. You have a nerve in here. You have another nerve present over there, and certain major nerve and artery are also present on that. Which, when we talk about flexor retinaculum, usually we focus on the median nerve. That median nerve is passing deep to it. In carpal tunnel syndrome, the median nerve can be involved. Fine, that is okay. But you know what is more important here is the structures which are superficial to flexor retinaculum, because in the laceration injury of the wrist, like all those suicidal injuries or the laceration injury of the wrist, if somebody slices their wrist, then what are the nerves and vessels which are like prone to injury or most likely to get injured are obviously the one which are superficial to retinaculum. So this tendon, this nerve, this blood vessel over there, they are the tendons which are more susceptible to injury. And that's why clinically, it is even more important to know that what structures are present superficial to the retinaculum. So it's not only about the deep structures, it's also about the superficial structures in there. Let me show you this, the flexor retinaculum again in the cross section, and then I'm gonna draw this diagram and make you understand that, guys. Look at this picture here, and I'll discuss these images with you again. But right now, here, see, this is the portion we already discussed, guys. This is extensor retinaculum, so let's forget about this. That's a lateral side and that is a medial side. That's a tendon arrangement in the extensor retinaculum. Okay. Let's come to this part here. Now, this is flexor retinaculum. One major difference that you see in the flexor and the extensor retinaculum is that there are no septations inside. So the flexor retinaculum, which is basically bridging between the lateralmost and the medialmost carpal bones, is forming a tunnel inside, and that is called as a carpal tunnel. So we have a single tunnel inside that is called as a carpal tunnel. It's not like there's no separate septation inside it, unlike the extensor retinaculum where we have first, second, third, fourth, fifth compartment. Nothing like that. We simply have one big tunnel here called as a carpal tunnel. What you see passing through the carpal tunnel is those tendons which have to go into the finger, like flexor digitorum superficialis, flexor digitorum profundus tendons are there. What else will be there? We have tendons which are going toward the thumb, like flexor pollicis longus and all, they are also in there. And you have an additional tendon over there, which is a muscle called as a flexor carpa radialis, will also be seen in there. We'll talk about that. So if this here is a flexor retinaculum, as we just said, there are certain structures. Look at that tendon and blood vessels. Some few things are superficial to it, and then we have structures deep to it here. The major structure present deep to it, which usually the examiner is bothered about, is this nerve here. That is a median nerve, and we know that compression of the median nerve in the carpal tunnel because of the pressure from this flexor retinaculum or the increased pressure inside this carpal tunnel leads to the carpal tunnel syndrome. Okay, let's discuss this diagrammatically and then we'll again come back to those pictures. Flexor retinaculum. Let me remind you what I said, that flexor and extensor retinaculum, the location, the attachment of the flexor retinaculum is on the carpal bones. Okay. So if I look at the carpal bones, let's say you're seeing it this way. You're looking at the palmar aspect here. If you're looking at the palmar aspect, guys, let's say here we have a scaphoid, and net distal to the scaphoid bone will be the trapezium. I'm just taking the concerned bone, scaphoid and trapezium. Medially, what you expect to see here, we got the pisiform, and this here will be the hamate. So these obviously the two carpal bones toward the lateral side and the two carpal bones toward the medial side you're looking at, and that is what is giving attachment to the flexor retinaculum. Obviously, you can go into more details of that. You can see what extension they're attached to. I'm just keeping it simple for you. Like they said, there is a crest of trapezium, tubercle of scaphoid, pisiform, hook of hamate. So all those projections are there on which this is attached. But let's simply remember the name of the bones which it is attached to: scaphoid, trapezium, hamate, and pisiform. Now this is how the flexor retinaculum is stretched between them in this manner. So one thing is about attachment, which you can see in the diagram only. We don't have to write it about it. So there we go. Now I'm using this picture to discuss the structures passing superficial to the flexor retinaculum. There are certain more things, a few more things to understand in the flexor retinaculum, but that we can understand only in the cross section, not in here. So let's go with this first. The structures passing superficial to the flexor retinaculum, if I start with a tendon here, there's a tendon. The only tendon that you see coming from the forearm in is present and attached to the superficial part of the flexor retinaculum and having an extension in the palm as palmar aponeurosis. That tendon is what? That is the tendon of palmaris longus. One thing that you'll see here is the tendon of palmaris longus, and this palmaris longus tendon in the further part will become a palmar aponeurosis only. I'll keep labeling all this. This is the palmaris longus tendon. So guys, we are looking at the structure superficial. We are looking at the superficial relations first. We are looking at the superficial relations first. Okay. On the ulnar side, you will see ulnar nerve and ulnar artery in there. So you will see ulnar nerve and then you will see this artery along with it, that is ulnar artery. Artery is more inside, nerve is more toward outside. That's ulnar nerve and ulnar artery. Right, remember these little things here. The nerve is more outside, that is more toward the medial side, and comparatively artery is more toward the lateral side if you compare both artery and nerve. Okay. What else is there in here? Now, there is a branch of the ulnar nerve which is in the proximal part, given in the proximal part, and that branch will also pass superficial to retinaculum. Like there's a nerve coming like this. It's a branch of the ulnar nerve, and that also passes superficial to the retinaculum. Median nerve is passing deep to retinaculum. So let's not talk about it. Median nerve is going deep to the retinaculum. But there is a branch of median nerve. Let's say if this is a median nerve which is going to go through the deeper part. But there is a branch of median nerve which also passes superficial to the retinaculum. And both these branches are called as the palmar branches because they are going to supply the skin of the palm. So we have a palmar branch, or you can say palmar cutaneous branch of ulnar nerve, and this is a palmar cutaneous branch of the median nerve. So let me write them together only. Both these nerves, these are called as the palmar cutaneous branches. Palmar cutaneous branches of what? Of median nerve and ulnar nerve. This is the ulnar nerve branch and there is a median nerve branch. There is one more structure which is present superficial to the retinaculum, and you people can easily guess this. If you remember the blood supply when we discussed, the arterial arches we discussed, we said radial artery will not go to the retinaculum, it will turn backward. But there was one branch of the radial artery which was going like this forward above the retinaculum or superficial to retinaculum to complete the superficial arch. And that was the superficial branch of radial artery. Radial artery is going back, but the superficial branch of radial artery will run in this manner, something like this, to complete the superficial palmar arch. This is the superficial branch of radial artery. So guys, all these structures are present superficial to retinaculum. Let me recap it. That's palmaris longus tendon will be there, as I said, which will continue further in the palm as palmar aponeurosis, a protective covering which is present over there, protecting all the nerves and vessels in the palm. Ulnar nerve and ulnar artery, main ulnar nerve and ulnar artery is there. A branch of ulnar nerve called as a palmar cutaneous branch of ulnar nerve, and similarly palmar cutaneous branch of median nerve also is passing superficial, and superficial branch of the radial artery which is going there to complete the superficial palmar arch. All these structures are superficial to the flexor retinaculum. The picture that I showed you in, you can see most of the structures there over there except the superficial branch of radial artery. If I just take you back to that image, then you will see that majority of the structures can be appreciated here except one. Now can you see that this here, guys, this is a tendon of palmaris longus. Look at that. That's a palmaris longus tendon. This nerve here is the palmar cutaneous branch of what nerve? Palmar cutaneous branch of median nerve. Look at that. What is the main nerve and artery inside here? The main artery nerve here is the ulnar nerve and ulnar artery. And then you can see a nerve also here, that is the, again, palmar cutaneous branch of this time what nerve? Ulnar nerve. Superficial branch of radial artery is not shown here, but that is also there in. So these are the structures which are running superficial to the flexor retinaculum. And that's why they are more vulnerable to injury also. If there is any laceration injury at their wrist, so these are the structures which are like more likely to be injured. If we remove the extensor flexor retinaculum, and we go deeper into it, so we are basically going into the carpal tunnel. So what is there in the carpal tunnel? And to look at that, it's better to see it in the cross section. So if I draw that cross section for you, let's see how it looks. So for the same flexor retinaculum only, I'm drawing a cross section or the transverse section for you. In the transverse section, you will see it's something in this manner, that we have a bone here on the, there's a hook of hamate, just let's say, and here we have the trapezium bone, that the crest of trapezium bone is there. That's a hamate bone, and that's a trapezium. When you see flexor retinaculum is stretching like this, now there's one thing to be noted, guys, that although ulnar artery and ulnar nerve are present superficial to the retinaculum, but they are having a superficial slip of the flexor retinaculum which is kind of giving a protective sheath on it. So there is a, like this, there is an extension coming from the flexor retinaculum. We call it superficial slip of flexor retinaculum, right? So that is the one which is holding this ulnar artery and ulnar nerve deep to it. Ulnar artery and ulnar nerve. Though we will still say that ulnar artery and ulnar nerve are superficial to flexor retinaculum, But yes, there is a superficial slip of flexor retinaculum which is kind of covering it. That is ulnar nerve and ulnar artery. Similarly, we have a deep slip. Look at this. This is a deep slip of the flexor retinaculum. And this deep slip of the flexor retinaculum is holding a separate compartment here for the tendon. And that tendon over there in this, which is again considered deep to the flexor retinaculum only, is the tendon of flexor carpi radialis, FCR. Flexor carpi toward the lateral side. Obviously, flexor carpi radialis is toward the radial side, toward the lateral side. Okay. Again, before drawing rest of the content inside, I want you to understand the way these tendons are arranged. Now we have a tendon of flexor digitorum superficialis and tendon of flexor digitorum profundus inside. Both are there. Superficialis B or profundus is there. We got a 4 tendons of superficialis and we have 4 tendons of flexor digitorum profundus. But if you look at this cross section here, if I just let me take you back here, look at this cross section. So we have 4 tendons and plus 4 tendons. Now no problem with flexor digitorum profundus, the one which are placed deeply here. So this is for the index finger, this is for middle finger, this is for ring finger, this is for little finger. No problem with FDP. But flexor digitorum superficialis tendon are arranged not in the same line. Now how they are arranged is in this manner. Look at my fingers here. Now my middle finger and ring finger are above and my index finger and little finger are above, and that's how they are arranged. So middle and index finger, middle and this ring finger, these tendons are the one which are above here. Index finger and little finger tendons are below, and you can see the arrangement also in that way. If I go from here 1, 2, 3 and 4. So if you just make your fingers in this way, you can remember that more superficially placed tendons of FDS, flexor digitorum superficialis, are for middle finger and ring finger. Slightly deeper to that, we have for the index finger and little finger. And most deeply placed are the 4 tendons of flexor digitorum profundus. That's how these tendons are placed. Along with that, you can see another tendon over there. That is a tendon for the thumb. Obviously, what one? Which one? That is a flexor pollicis longus. A long muscle for the flexion of thumb. That is a flexor pollicis longus. And of course, needless to say, the nerve present inside is the median nerve. The nerve inside is a median nerve. So let's put it in the diagram here. So as we said, we have tendons placed in this way. 1, 2, 3 and 4. These are FDS tendons. FDP tendons, no problem. 1, 2, 3, 4 in a straight line. Let me just put them together here. So these are the 4 tendons of FDS. And these are the 4 tendons of FDP. Which other tendon was there? This was the tendon of flexor pollicis longus. Flexor pollicis longus. And the nerve in there is a median nerve. The main nerve present inside is median nerve. Also, between the FDS and FDP, now you have like 8 tendons present over there. So there are chances of having a lot of friction in this. So that's why we have a synovial sheath present around them. And because the synovial sheath which is present in between this tendon is present toward the ulnar side, so we call it ulnar bursa. And the synovial sheath which is covering the flexor pollicis longus will be the radial bursa, the one which will be covering it, the radial bursa. So something like this. We have a bursa here and we do have a bursa here as well. Let me write that for you. This bursa here is what? That is the ulnar bursa. Along with the tendons of what? Along with the tendons of FDS and tendon of FDP, flexor digitorum superficialis and flexor digitorum profundus. Let me remind you again, these 2 tendons, the highest one are for the middle finger and the ring finger. Then the more on the side and the deeper one, this one is for the, obviously for the index finger and little finger, FDS tendon, and these are the tendon for FDP, flexor digitorum profundus. This one is, what bursa is there? There is the ulnar bursa. There is a radial bursa on the lateral side, sorry. This is a radial bursa. Radial bursa along with the tendon of flexor pollicis longus, one of the long muscle in the anterior compartment of forearm, flexor pollicis longus. And needless to say that the main nerve present in there, that is the median nerve. And as we all know that compression of median nerve in the carpal tunnel or deep to the flexor retinaculum is called as a carpal tunnel syndrome. So this is about the structures present in relation to the flexor retinaculum. The structure is superficial to it, and now we're looking at the structures deep to it. Even FCR, flexor carporadialis, is considered deep to the flexor retinaculum, although it is separated from rest of the tendons or rest of the structures by the deep slip of the flexor retinaculum. This was the superficial slip, and this is a deep slip of the flexor retinaculum. Finally, let me again put that picture for you so that you can have a good comparison. The FDS and FDB tendon, and you can see the bursa which is all covering it here. This bursa here is what bursa? That is the one which shown in this color here. That is the ulnar bursa. Look at the bursa which is present around in this, the tendon of flexor pollicis longus covered by the radial bursa. The nerve is median nerve. Look at the deep slip over there going in here. This is holding the tendon of FCR, flexor carpi radialis. So that is about the flexor retinaculum and extensor retinaculum, and also about the anatomical